Welcome to my channel, Chemo Pharmacology 101. My name is Lisa and I am a board-certified oncology pharmacist. In this video, I will be talking about Teclistamab. Its brand name is Tecvayli. Teclistamab is a bispecific T-cell engager. Bispecific T-cell engagers are medications that act by binding a marker on tumor cells and the CD3 positive T cells. By linking them together, they allow the T cell to recognize the tumor and they activate the immune system to destroy tumor cells. The marker that this bispecific T cell engager targets is BCMA, or B cell maturation antigen. In an ideal world, the marker is present only on tumor cells and not on normal tissue, but this is not always the case. BCMA is also present on some healthy B cell lineage cells. Teclistamab is a bispecific T cell engager that binds BCMA on multiple myeloma cells and CD3 on T cells. And BCMA is expressed on some mature B lymphocytes. There are two different concentrations of the Teclistamab subcutaneous product. There are two different strengths of the same medication to facilitate the step-up dosing. Patients receive low doses at the beginning of therapy and higher doses as they tolerate the lower doses. Teclistamab is FDA approved for relapsed or refractory multiple myeloma in patients who have received at least 4 prior lines of therapy, including a proteasome inhibitor, an immunomodulatory agent, and an anti-CD38 monoclonal antibody. It is given as a subcutaneous injection, and doses are increased as the patient tolerates the step-up dosing schedule. Pre-medications are required due to the risk of reactions and cytokine release syndrome. It is recommended to give acetaminophen, diphenhydramine, and dexamethasone 1 to 3 hours before the Teclistamab dose. These doses can be given either orally or IV. Patients who experience cytokine release syndrome with a previous dose or need to ramp back up due to a dosing delay should continue receiving pre-medications as long as they need to. The first 3 doses of Teclistamab are recommended to be administered in the hospital setting. It is recommended to keep patients hospitalized for 48 hours after all doses in the step-up dosing schedule. Doses may be shifted by 2 to 4 days depending on tolerability, and you may also delay the next dose for up to 7 days to allow for full resolution of adverse effects. As you can see on this chart, patients receive doses on day 1, 4, and 7. The step-up dose 1 is the lowest dose at 0.06 milligrams per kilogram. Step-up dose 2 is slightly higher at 0.3 milligrams per kilogram, and the full dose is 1.5 milligrams per kilogram. Some institutions do use a 1-3-5 dosing schedule. Teclistamab should be administered via subcutaneous injection under the skin. The preferred administration site is in the abdomen, but other sites, such as the thigh, can be used. If multiple injections are required, injection sites should be at least 2 centimeters apart, and it is recommended to avoid areas where there are scars, bruises, open sores, or tattoos. Pre-medications can be discontinued once the patient has tolerated a full treatment dose and also tolerated the previous dose without cytokine release syndrome. Starting 1 week after the first full dose, patients receive the next full treatment dose of 1.5 milligrams per kilogram starting on week 2, and then they receive this dose weekly. If patients achieve and maintain a complete response for at least 6 months, the patient can be moved to receiving doses every 2 weeks at the same dose level. If patients experience delays between doses, either due to adverse events, or other delays, please refer to the package insert for specific dosing or re-step up information. It is expected that teclistamab is metabolized into small peptides by catabolic pathways. There are several side effects to monitor for after patients receive their teclistamab doses, including injection site reactions, myelosuppression, neurotoxicity, cytokine release syndrome, increased liver function tests with or without cytokine release syndrome, fatigue, infections, hypogammaglobulinemia, musculoskeletal pain, headache, nausea, and decreases in some electrolytes. Neurotoxicity can occur in up to 8% of patients. Cytokine release syndrome can happen in up to 75% of patients, but a majority of these reactions are grade 1 or grade 2, and only 0.6% were grade 3. Patients are most likely to react to the first dose. Up to 42% of patients can react to that dose. 35% of patients react to dose number 2, and 24% of patients react to the first full treatment dose, or dose number 3. In the ramp-up studies, less than 3% of patients experience recurrent cytokine release syndrome. If patients experience cytokine release syndrome, they may experience decreased CYP450 activity. It is recommended that patients receive antiviral and pneumocystis prophylaxis, as reactivations of herpes zoster and pneumocystis have been seen. And it is also recommended to consider monitoring IgG levels for patients to make sure that patients don't have hypogammaglobulinemia, which can put them at risk for several kinds of infections. Teclistamab, or Tecvayli, is only available under a REMS program. Prescribers and pharmacies must enroll in the REMS program to be able to dispense doses. By participating in this REMS program, they acknowledge the risks of cytokine release syndrome and ICANS. And patients and caregivers must be counseled on the risk of cytokine release syndrome and ICANS, and patients should be instructed to carry a wallet card stating that they are undergoing treatment with Tecvayli at all times. And then patients should also not drive for at least 48 hours following their doses. Thank you so much for watching. If you have any questions for me, I will do my best to answer them in the comments below. And if you like this recording, please like the video and subscribe.